Jimmy, sorry, just a quick one. You're actually still muted.
Hi everyone, I thought I'd taken my mute off. Apologies for that. You think that the amount of times I've done these sessions now, I've been most used to them. Welcome everyone, wherever you are in the world, today to our third and last session in this COVID-19 webinar series. Is this a continuation of the pandemic we see before us, or are we in sight of the end game? With vaccination rollouts and easing of lockdown restrictions happening worldwide, albeit at different speeds and stages, the hope is we've begun to move out of the COVID-19 pandemic and into a landscape of not so all-encompassing endemics. But is this true or just wishful thinking? As I said, this is the last part of our final free COVID webinar series, Building Health and Safety Practice to a New World, in which we'll provide expert insight into the latter stages of a COVID-19 pandemic that has tested employers, IOSH professionals, and people the world over the last 18 months. And what a panel we have for you today. So when will it end? How soon can we move around with genuine confidence? Just how vigilant will we have to continue to be? How will the pandemic affect workplaces, the IOSH profession, and global society long term? What legacy is it likely to leave, and will it change the world forever? These are the sorts of questions we'll be focusing on in this IOSH COVID webinar. And anyone that's worked or seen a webinar that I've been hosting, I like to try and get as many questions out. I like to try and get as many answers from our experts, and I like to try and make it as inclusive as possible. The style that we do this is we interact. I'll do some chats, I'll ask the questions to the panel, and time permitting, we'll get as many questions from you all as possible. So before we go on then, just a quick word about our panelists. One of our first panelists is Dr. Lars Petersen. Dr. Lars is a Norwegian-born medical director with International SOS, focusing on medical services and consultancies. Prior to assuming his current position, Lars gained over 30 years of international experience within a number of multinational health agencies, such as the Dutch Ministry of Foreign Affairs, several Dutch NGOs, Medicine Sans Frontières, and several universities. He has practices medicine in Norway, the Netherlands, the Dutch Antilles, Zambia, and Kenya, and still works as a general practitioner in the Netherlands, with previous occasional locums in Norway. His area of expertise is general medicine, tropical medicine, travel medicine, international health, remote health care support, pandemic planning, disease outbreaks, infectious disease. Welcome, Dr. Lars. The second of our panelists today is Claire. Claire studied modern languages at the University of Cambridge and embarked on a career in health and research journalism and communications before developing her passion for psychology. Claire holds an MSc in psychology and an MSc in organisational psychology, and is experienced in providing coaching and counselling support work across a range of settings. Throughout her career, Claire has held a commitment to evidence-based practice and belief in the power of effective communications. Claire is interested in how we can support health and well-being in organisations by talking and listening at the individual level, but also by institutional ways of communicating that are kind, honest, and inclusive. Claire's current activities include conducting research with Infinity to investigate organisational responses to COVID-19, counselling support work with suicidal adults, and working as a speechwriter in the field of global public health. Welcome, Claire Bowerman today. Thank you, Claire. Wonderful to see you.
Hello.
And continuing on further, we have Louise Hosking. Loads of you will all know Louise, and Louise will not need much introduction. A very successful businesswoman in her own right, owning a fantastic consultancy. Louise is our president-elect, and looking to take over the presidential chair in November and also as the new chair of council. Welcome, Louise. And finally, last but not least, one of our elder statesmen in the presidential team, someone who has seen it all, done it all when it comes to IOSH volunteering, has been around a long time within IOSH, is an absolutely prolific volunteer, council member, and a member of the presidential team. Welcome, Tim Elmridge, Vice President of IOSH. Well, here we go, everyone. Let's just go straight into it. And that's the longest introduction I think I've ever done. How are you all? Dr. Lars, are you good? Wonderful. Tim?
I'm great, Jimmy, thank you.
Thank you. Claire?
Great, thanks, Jimmy.
Welcome, Anne-Louise.
Ready to go.
Wonderful. Okay, here we go then. Let's get on with our first question. This question comes to you, Lars, straight away. I may as well throw you straight in at the deep end here. Historically, has there been a certain length of time that a pandemic will last?
It varies a lot. One of the first pandemics that were described in history was in from year 165 to 180, the so-called Antonine Plague, causing the loss of 5 million lives, and it lasted 15 years. We had, of course, the Spanish flu in 1980 to 1920, lasted about 2 years and caused about 50 million deaths. Then we had the maybe longest lasting, or we still have the maybe longest lasting pandemic, which is the HIV/AIDS pandemic, which has gone on for more than 40 years since it started in early 80s and has costed more than 30 million lives. Currently, we have the COVID pandemic, which started in December 2019. That's why we call it COVID-19. So we are in very early days of this pandemic, if you look at it from a historical perspective. And how long it's going to last, that's something we will talk about more later today, I think. One thing I can say, it's not over yet. It's not on its demise. It's still very much a global pandemic with increasing number of cases and active outbreaks in large parts of the world.
Wonderful, Lars. And just before I go on, anyone who has any questions, please place these questions in the Q&A. I may have missed that out. And please don't put them in the chat. All our welcomes and highs in the chat, please, but please stick them in the Q&A and I'll get them to our experts. Well, continuing on from that then, Lars, do pandemics tend to scale down into a series of endemics before they die out? And do you think that COVID-19 will ever die out?
COVID-19 is now firmly established in all countries around the world. As I said, a lot of countries, especially developing countries, are still in an active outbreak mode, and the number of cases are increasing. In Europe, it is getting under control because of the high vaccination rates, but that's, I would say, an exception to the rule. We still have, the growing number of cases globally, and I don't see it fade away for the time being. The African Health Organization have estimated that by 2024, in the best case scenario, they will have vaccinated maybe half of the adult African population. So it's still going to take a long time. You have countries at war, like Syria, Yemen, and others, where there is no vaccination at all and no hope of starting any kind of vaccination for the foreseeable future. And that means that we will continue to have outbreaks, localized or regional, and maybe even global. In the end, and when that end is, that's a big glass ball, it will indeed become endemic, which means it's present in society, the virus is circulating, and might cause local outbreaks, but it will take a long time before we get there. One of the things which needs to happen is that we approach this as a truly global problem and approach it as a world community. And as long as we don't vaccinate the world, we will not get the pandemic under control. And I'm very sorry to start off this webinar with such negative news, but that's the reality.
Well, you're absolutely here, and it's great to have your view on it as well, Laz. And you just talked about the vaccination there throughout the world, and I'd lead on to that to maybe another point. And how confident can we be in the vaccines? Particularly with the threat of new variants. Do vaccines hold the key to us moving on from COVID-19 with some degree of confidence and freedom? I mean, wherever you read, wherever you look, the amount of media that's out there, there doesn't seem to be a straight answer, Lars.
Well, I think there is. As we speak today, more than 6 billion doses of vaccines have been administered. That means that we have an enormous amount of material we can do research on, and see how efficient the vaccines are and how safe they are. And there is no doubt that the vaccines are highly efficient. They do protect for more than 90% against severe disease and deaths, and that's exactly what you want to achieve from a vaccine. More efficient than maybe any of the vaccines we've seen so far. And as for the safety, based on the trials and based on the 6 billion doses which have been administered, we now can say very confidently that the vaccines are safe. Yes, some people do experience side effects, very rarely severe side effects, but in the big picture, the vaccines are very, very safe and highly efficient. And we see in the countries like in Europe, Denmark as an example, the Netherlands where I'm based as an example, vaccination rate is now so high, we hardly see any severe cases anymore, we hardly see any hospitalizations anymore, and the number of deaths is decreasing rapidly. While in other countries, in the United States, is a very good example where vaccination rate has become stuck more or less at around 50%. We see a true pandemic of the unvaccinated people with a large number, an increasing number of cases, and a healthcare system which is in the affected states being totally overwhelmed. And that shows very clearly the difference between the unvaccinated and the vaccinated countries. Wow. And unfortunately, as I said, most of the countries in the world have not yet started or only slowly started with vaccinations. Africa, less than 3% of the population is vaccinated so far.
Wow, I mean, that's just that last couple of minutes there, just listening to this, just really, widen my eyes. And I'm going to come to you, Claire Bowerman. I mean, you're nodding your head there. Is there anything you'd like to add? And before I bring in Louise and Tim.
Yeah, I would just agree with what Lars is saying there, and I'd also add that the vaccines have been an incredible medical achievement. They've never had this before. Previous pandemics, SARS, Ebola, there have not been available vaccines, and so those pandemics have been controlled by other measures, including social distancing measures. And the truth is, in many different contexts, that will continue alongside vaccines for COVID-19.
Wonderful, thank you, Claire. Tim?
Yeah, I think it's really interesting, and I think one of the things I'll say, so I work for a large global organization, and we've got quite a large presence in China. So I've been dealing with this, this virus now for a year and 3 quarters. I think one of the things I would really say as a health and safety professional, and really focus on in our audience, all of those health and safety professionals, is let's just know our limits of our expertise. So in my organization, we've been very clear that the likes of Dr. Lars and other medical professionals are the ones to really advise us. So, when it's come down, when we started off with even mask wearing, does mask wearing work or not? As a health and safety professional, I'm not qualified to say that, but we went to our medical experts, and we've moved on through, testing, which was a massive thing, and then now through to vaccination. So, it's great to hear, and I hear regularly that the vaccination is the most effective way of controlling the virus, and we'll talk a little bit more about some of the implications for that in the workplace. But let's listen to our medical experts; they know what they're talking about.
Thanks, Tim. And Louise.
Yeah, I was just looking at some of the comments actually that are coming through in the Q&A box.
I want to stop.
Yeah.
Go on. Can we just
And,
stop there, please? Don't.
sorry?
Okay, we'll go through them all because I want to hand them
Oh,
out.
no, don't worry. There's just some really interesting comments around, we are going to have to live with this for a long time.
Yeah.
And it needs to be part and parcel of what we do day to day. And it's tough. It's not easy. There's no magic bullet.
Absolutely, Louise. No, I couldn't agree more. And panelists, I'd just like to have a look at the Q&A there. And if there's any questions that you'd like to answer, if you just indicate to me after the next question that you want to come back to one of those questions. A lot of them started popping up when Dr. Lars was talking, but I don't feel that I don't want you asking them all, Dr. Lars, and thinking that we're throwing you under the bus. But if there's any in particular in there, I think Louise indicated there might be one or two that Louise might want to answer. Just have a look at them and then come to me, just send me a message in chat and I'll make sure that question gets directed to you. So everyone, we will get to those questions. Just before we're going to ask one question now though, just before we move on to a question for Tim shortly. One of the it's a message that comes up here, and it's more or less just talking we were talking about, Lars. Are we putting our eggs in one basket by placing so much confidence in the vaccine at the cost of other workplace control measures? What about new variants of concern? So that might be one for a couple of you.
Yes, I can start off. So the variants of concern, of course, at the moment, we have the Delta variant, which is a dominant variant in most countries now, which is highly contagious, much more contagious than the other variants. And that's why we are concerned. The good news is it doesn't cause a more severe clinical picture, more severe disease. There are variants popping up every week. Viruses do mutate, that's the nature of viruses. And most of the mutations will weaken the virus and will just fade away and die out. But some, like the Delta variant, makes the virus more virulent, so more infectious. And those are the viruses and the strains that do survive. We've had several viruses and mutations popping up over the past few weeks. There's been talk about the Mu, the Lambda, C1.2, and then of course we have the Alpha, Beta, Gamma variants of concern. What we do see is that all of these variants do have mutations in the spikes, which means that the spike is becoming more sticky and can attach easier to a human cell. But some of the variants, like the Mu variant, which has been written a lot about, does actually have more mutations than the Delta variant, but also have deficiencies and is actually fading out as we speak. But of course, the more viruses that circulate, so the higher global level of virus circulation there is, the more mutations there will be. And then the theoretical possibility of new and aggressive variants popping up is certainly true. And that's exactly one of the reasons why it's so important to get the world vaccinated. Because by vaccinating the world, you also suppress the level of circulating viruses, and the virus will fade out, maybe not disappear altogether, but will fade out, and there will be much less mutations. So if we can get our act together as a global community and vaccinate the world, then we can get this under control. But until then, yeah, we do have a problem.
Okay, got it, Lars. And panel? Any of you? Go on, Tim.
Yeah, I jump in again. One of the things I wanted just to touch on is the difference between a workplace control, which we're very familiar with as health and safety professionals, and a public health control. And vaccination, and Dr. Lars, please, come in if you don't agree with me, because I'm sure it'd be good. For me, vaccination is very much a public health control, a very effective one, as Dr. Lars has said. However, bringing that into the workplace as a workplace control is not simple. We'll probably talk about this a little bit later, Jimmy, because I know there's a question.
Yeah, no problem, Tim.
But let's remember the hierarchy of control and thinking about the workplace controls we've got. We've got ventilation, we've got hygiene, we've got mask wearing, we've got social distancing. Those are the things that we really need to focus on in the workplace, and then look at the vaccination as an additional additive to that, but with a lot of caution, which we will talk about.
And there are some questions in that Q&A, Tim, that you can answer live. So if you see one or two that fall into that category, please just tick on it, answer live, and let me know, and I'll come to you straight away. Dr. Lars, would you like to respond?
Yeah, so it's Tim, what you're talking about is actually what we call the Swiss cheese model. So all of these precautions have their holes in it. I think a lot of you are familiar with this model. All of these precautions, whether it's hand washing or social distancing, have holes in it. But if you put several layers of this Swiss cheese together, the holes will be smaller and the protection will be higher. And it's clear that vaccinations is by far the biggest slice of this Swiss cheese. So it should all be done simultaneously. At the moment, we are in the situation that in most countries around the world, the vaccination rate is simply not high enough, so you need to take additional precautions to protect yourself and your colleagues and society as a whole against the virus. But there's one thing I would like to mention is that we are facing the biggest public health crisis we've had in years. And the only way to approach this and deal with it and get it under control is to approach it from a public health perspective. We are so used, certainly in Europe, to talk about individual freedoms. People want this and that, and companies or organizations having their own policies and procedures in place. We live in a world where the individual is always about society. If you look at China, we know that society is always about the individual, and that's why in China it's much more easy to implement public health measures, efficient public health measures, regardless of the individual. And that's why they're getting it under control in Asia much faster and better than we do, because we still continue to think about the individual, and we have the whole discussion about people who don't want to get vaccinated, etc., etc. But if we look at it from a public health perspective, we really need to approach society as a whole and the global community as a whole, as I've said, and that's the only way to get this under control.
Wonderful. Thank you, Lars. Thank you, Tim. I've seen you scribbling down there. Hosking, would you like to have a quick response, Louise?
Yeah, I mean, you've heard me talk about this before when we talk about public health. So I began my career as an environmental health officer. And I remember the first weeks of lectures that we had where, we talked about, positive public health and how that's, saved more lives than any medical breakthrough. And we've learned some of these lessons in the past. And I think we can draw on some of those lessons and look at, how we've dealt with disease, infection in the past. And it's about, forward looking and being more prepared than we have been. It's about more planning. We know what we need to do, and if this time has taught us anything, it's just how connected we are. If we look at how our supply chains have been affected, our worlds, our lives have all been turned upside down, and that interconnectedness is going to be the piece that takes us forward.
Wonderful, Louise. Great response. Thank you. And a very quick one from you, Claire.
Yeah, I was just going to agree completely with Louise and say that unfortunately, because of growing things like climate change, the risks of pandemics are increasing generally. And so this really isn't necessarily just about COVID-19. It's about taking the lessons that we've learned and putting them properly into place so that we can contain any future disease outbreak really early on.
Wonderful. No, thank you, Claire. Thank you all on those questions there. Thank you again, Lars. I'm going to come to you now, Tim. And thank you for the question. I'll come back to you in a minute who gave the question, but thank you, Tim. What can IOSH professionals and companies do to promote the use of vaccines? And will the respective roles vary from country to country, Tim?
I think I'll just lean back on what I said earlier, that, we've already heard from Dr. Lars about the effectiveness of vaccines. And we'll talk a little bit later, I'm sure, that vaccines are very effective, but not 100% effective. So we'll come on to some of the challenges around that. Going back to the idea of, vaccine being a population health measure, we as health and safety professionals clearly want to promote that. And I'm doing, within my organization, strongly recommending that all eligible employees get an uptake of their vaccination. But we're doing that by saying, participate in your government, vaccination program. And, fortunately, most governments, I would say, around the world have some form of vaccination program. We know there are challenges in some of the more underdeveloped parts of the world. And that's another story about how the developed and the non-developed countries work together. But yeah, as health and safety professionals, of course, we want to recommend our employees be vaccinated because it's such an effective population health measure. What we have to be very careful about, and I am doing a bit of a teaser on this, Jimmy, because I know we're coming to it later, and there's questions popping up all the time, do we say no jab, no job? And I've got a very strong opinion on that, which I will perhaps share a little bit later. Yeah.
Wonderful. Panel? Claire?
I think as IOSH professionals, we can, although we're operating in a very different context, we can learn a lot from kind of successful community health rollouts, and we can learn a lot about communications, basically. Are we as organisations talking to employee groups in our own communities who are harder to reach and who are less susceptible to vaccines? Are we actually, do they trust us? Are we having good conversations with those groups? Do we have representatives who could kind of support communications to those groups? That's really, really important. And also from an employment perspective, are there any barriers to those people getting vaccinated? In our research, we have spoken to people who said they've got staff who haven't got their vaccine because they're too busy, or they're kind of worried about being ill for the job. We can at least look at those measures.
No, yeah.
I think one of the keys to success to get this under control is indeed communication and information. And one of the very alarming things, and I think lessons learned for the future, is I would say overall negative role of media, especially social media, with fake news, conspiracy theories, etc., etc. And if you Google COVID, you'll get about 10 million sites or something. It's impossible for lay people to kind of get the right information. So you need objective, factual information, which is exactly what we're trying to do, and to give to companies and organizations so they can use that to build the policies and procedures around it. But communication is absolute key, because there's so much, and pardon my French, rubbish out there, and that has been playing a very, very bad and contributing role to the spread of this pandemic.
Thank you, Lars. I hope you weren't going to say that, Louise, because I was bringing you in next before Lars came in. I hope we didn't pinch your answer.
No. I think this is a great conversation, isn't it? I think that organisations have a huge part to play, and if they can communicate that message in the way that Lars was describing is immensely important, because there are people around the world who don't know who to trust. They maybe don't trust their own governments about what they're saying. And so employers have got a really important role to play in all of this. And I think those large organizations, global organizations that have got extensive supply chains can potentially play that role as well to communicate the right kind of information. I mean, I saw someone in the chat say, we can't criminalize not having the vaccine. But if we give people the right information that they can understand, we can encourage them to make, their own risk-based choices.
Yeah, no, and again, I totally agree, and it's great being the chair, because I'm getting all the answers. I'm not doing any work here. I'm getting here. I'm just being able to nod and agree. But everything you're saying is that's probably the way that I would have looked into it. So in terms of, here we go. There's a question here. A colleague of mine, this one's, and I need short answers now to this, please, because we're getting close to time. A colleague of mine recently commented that the UK government has made the decision that they want COVID infections to spread throughout the population, hence the relaxation of preventative requirements. Do the panel agree? Oh, you know, I'm not going to throw anybody under the bus there. Anybody at all can answer that one. So who wants to come in first? Go on then, Lars.
I think that's what's happening in Denmark and in other countries at the moment. You know, the Danish government has essentially said we're finished with COVID, it's over, we have it under control, it's not an essential disease anymore. When you have a certain level of protection in society, so the herd immunity, and you have protected the vulnerable population, so people, the elderly, people with underlying diseases, etc., then the virus is likely to cause very little harm. And then there is something to say to let it circulate, controlled circulate, to improve and increase the herd immunity. But it's a risky tactic, and you need to do that, and you can only do that in societies or communities where you have a high level of protection and where the vulnerable groups are protected. Because if we have done that from the beginning, we would have seen a lot more severe diseases, a lot more deaths than we've seen up to today. So it is something which is known in outbreak management control, and depending on what type of disease you're dealing with, what type of virus you're dealing with. In fact, influenza is allowed to spread freely every year. Does cause a number of deaths. Some of the vulnerable people are protected by vaccination, but not all by far. But we do allow that to circulate freely, and nobody has ever raised a question about that. So it's certainly something to consider, but very, very controlled.
I mean, it's the ultimate risk-based choice that they're making, isn't it? It's, we've got to look at, everything that contributes into this. I mean, I know that we're going to talk to Claire about, the psychosocial risks of keeping people isolated and, keeping people away from each other. And it's, the governments around the world have got to make some really difficult choices about how they, allow regular business to continue into the future. And we've got to look at all of the risks that are out there when we're making those choices. It's the ultimate risk assessment, isn't it?
Yeah, no, absolutely, Louise. Claire?
Yeah, I completely agree with that. It's a risk assessment exercise. There's benefits and harms. And certainly, I mean, in terms of mental health, there's a huge risk associated with income loss and job loss, and that's basically now what we're looking at, and the kind of balances we're trying to strike, I'm afraid.
I remember we discussed that yesterday quickly in our pre-meeting, didn't we, Claire? It's a real worry of mine as well. Being in the construction industry and planning, these plans are set in stone, and there's only so much leeway the clients will give you before they start saying, well, and then you're dealing with the controls, and as everybody knows, there's really tight boundaries, especially in construction. Where do you move it to? How do you make sure that the controls are still in place and all the welfare is going, and looking at the hierarchy of controls as well, but also looking at mental health part, how it affects not just the person that's coming to work on the train in the morning, but those people that are making big decisions. So I think there's a bigger picture here as well. Okay, I just want to come to you now, if I may, Louise. Here we go. Do you see some employers taking the view that the pandemic is over and any restrictions have become unnecessary? If so, what would you say? So let me go through that again, sorry, Louise. Do you see some employers taking the view that the pandemic is over and that any restrictions have become unnecessary? If so, what would you say to them, Louise? And before you answer, Louise, can I just say, everyone, everybody that's listening, that the panelists wanted to answer each question in turn. So there's some of you in there that are not particularly happy about the way the questions have been answered, but the other way the questions wanted to be answered by the panelists. Thank you very much, Louise.
Yeah, no, thanks for that question, Jimmy. That's a huge, I mean, I'd be really interested to hear what people think in the chat actually about whether employers are taking this seriously. But being an employer, you know, I am also an employer, and being an employer is really tough. You know, we've got to keep our businesses going. You know, we're responsible for people's mortgages, and so you have that pull on, you know, I need to get back into business, but then you've got to manage these risks. What I would, from what I see, you know, and I work with a whole range of different sectors, those people that I'm working with certainly are taking this very seriously, because they don't want their people off sick. You know, we've really focused on health in an enormous way, and organisations, you know, they don't want their people to be sick. They don't want to lose their people at the moment. We've also got a skills, you know, crisis going on too. So from where I sit, I feel employers are taking this very seriously, and it's a difficult job to keep it going, because complacency starts to set in and individuals change the way that they're reacting. So the short answer is, I think employers are doing the right thing. We're always going to have people that are not doing the right thing, but in general, they want to look after their people right now.
Absolutely, reason. And I held a workforce engagement meeting last Friday, and the one thing that came out from it was quite funny. Well, not funny, but they all want the tables to be split down back to 4 again. They want the screens taken away, and they only want, they can still, they don't want to look. They're saying, but we go to restaurants and we don't have to do this. Well, there's a bigger picture here, you know, in terms of the size of the area as well, and the controls that are in there, and we're trying to do what we can. But then the other part was, they didn't want face coverings to be removed in the hoists. So, you know, they're actually, you know, our workforce are thinking about them, thinking for themselves and others, but it just puts so much more into the mix. And I'd really be interested in what you think about that, Tim.
Yeah, I think just a couple of things that immediately spring to mind is you have a choice about whether you go to a restaurant or not. You don't necessarily have a choice whether you go into the workplace or not. So there is a different duty of care, which I'm sure we're all familiar with. But I think you're right. I mean, there is a tension, and I see this around all of the countries in which my organisation operates, is that where the restrictions are being eased in general society, there's a feeling that they should be removed within the workplace too. But what I'd say is, I mean, you can do both. So I mean, social distancing, particularly in say in some countries it's 2 meters, in others it's 1.5 meters. You know, you can do things around that, but retain other workplace controls. So, I mean, you know, the ventilation system changes that I'm sure many organizations have put in, you know, we don't need to change those back. I know there's some environmental issues around the energy use, but fundamentally they work. You know, we have, we can continue to encourage the wear of face masks. If people don't want to wear them, then obviously if it's not mandated, then, you know, that's their personal decision. But, you know, and the hygiene, and what I've just said to my organization is, we will never remove the hand sanitizer, you know, stations. We'll never remove the cleaning regimes now, because it's just the right thing to do, right?
Absolutely. Claire?
Yeah, I'd agree, really. And the trouble is, as we've said, organisations are balancing up different risks all of the time. Like, one of the things we've seen during the pandemic is some companies saying that they've seen an increase in other sorts of accidents because people are concentrating on COVID, so they weren't holding onto the handrail. You know, we're all bearing different risks in mind all the time, including the economic risks of our companies failing. So it makes sense to implement those kind of measures that don't just rely on individuals all of the time having to amend their behaviours. And we also just need access to the best information. Companies need access to the best information so that they can react early when they really need to. But I've seen very few organisations who don't care. They're just balancing up different problems.
Yeah, good. Okay, I'm going to start moving on now, and I'm going to only start coming to 1 or 2 of you at a time after each question now. So if it's a really pertinent point you want to make, please raise your hand, panelists, and I'll bring you in. But we've got a few more questions to go, and I'm just very conscious of the time. It's wonderful, but there is never enough time. So thank you everyone so far. Okay, so you've all warmed up now. You've all had a question each. So let's go to, oh, it's for you, Claire. Would you say the COVID-19 experience has put employees' mental health higher up the IOSH agenda? If so, why do you think this is the case? How much of this has been positive and how much has been negative? Now, this is an all-day. This is an all-day session, this one, isn't it?
This is an all-day session. I mean, the short answer is yes, definitely we've seen it rise up the agendas. We've seen mental health as a board priority in lots of cases. We've seen mental health linked into wider strategic goals, linked into the Sustainable Development Goal of decent work. We see it linked into broader social impact agendas. So yes. Why is this? Firstly, I think that mental health has become part of many national conversations during COVID-19. You know, at the start of lockdown, there were certainly indicators that depression and anxiety rose in populations. Another key driver, I think, has been the dramatic increase in home working, because really for home workers, psychological health and well-being has been such a predominant concern. I'd say in the research we do, if you ask a home worker about their organisation's health and wellbeing provision during COVID, they'll often mention psychological health and wellbeing first. I would say I think it's a really good thing generally, because it's increased the parity between mental health and physical health that has actually really been needed. So there aren't those downsides. Perhaps a risk is where organisations are coming up with kind of slightly cursory responses to supporting health and well-being, because what we know, and we've seen again in the pandemic, is that really job design is actually completely key if you want positive health and well-being. The manager, the role of the line manager is absolutely essential. No manner of kind of interventions are going to get over those factors. So yes, but with
wonderful answer, Claire. Thank you, Lars. And I'm coming to you, Louise, just quickly, both of you, because we're running out of time. Thank you, Lars.
What was the question again for me?
Oh no, it wasn't a question. It was in response to Claire, and Claire talking about the mental health part.
No, mental health is. I mean, we see a tremendous increase in mental health cases due to several reasons. COVID itself can cause mental health issues because it can affect our neurological system, but it's more the situation we've been in over the past 18 months with isolation, with loneliness, anxiety, fear of being infected, fear of family, friends being infected, becoming sick and dying. So we have seen objectively, and we've done some studies on that as well, that there is a significant increase in anxiety disorders, depression, and even suicides. So mental health is absolutely one of the big issues at the moment, and which will continue to be a big issue long after COVID. And indeed, we see it coming up on the agenda on the organizations we're working with.
Thank you very much, Lars. Okay, Louise, and then I'll move on to the next question. Sorry.
Yeah, so I mean, this is a topic in its own right, as Claire has suggested. You know, managing mental health is like managing jelly, as a famous psychologist once said to me. And before all of this, we were starting to focus more and more on this, and you know, what are the things that drives employers to have good standards for their people, and I think you know employers want their people to be at work, they want them to be productive. So you know Jimmy, that I love talking about preventing risk by good design, and how we organize our companies and organizations are absolutely key to this, and the leaders within our organizations have really got to look hard at how they do that and make some difficult choices for themselves, and I think one of the positives that are going to come out of all of this is that there'll be much more of a focus going forward.
Absolutely, Louise. No, wonderful. And you know, and three great responses. I am going to bring you in, Tim. I am reminded that it is till 2:00 today. It's just that when I see over 60 questions, I've never seen this many questions in a panel webinar yet, and we've been doing these 18 months. So that's why I'm being a bit naughty and driving you on a little bit. So, but yes, please respond to him, and thank you, Louise. Yeah, and we could talk about this all day.
I think absolutely recognising everything everyone's said, but just flip it over and look at some of the positives. So one of the positives I think for mental health, this is generalisation, but I think it applies, is organisations now recognising the importance of giving their people flexibility where they can. So, you know, okay, so many organisations had to force their employees to work from home or not work at all, and that had the impacts that we've talked about. But one of the things that we talk about in my organisation is we mustn't go back to the way we were, because the way we were wasn't right. You know, people, you know, feeling obliged to come in, you know, to come into the office or go to the workplace 5 days a week through massive commutes, the management pressure to be seen, you know, because if you're not seen, you're not working. Whereas that's just been flipped on its head. And most organisations say, hang on, these people can work remotely and can be actually pretty damn good at working. So, you know, I hope that will have a really positive impact on many people. But of course, providing the opportunity for those who find the home not a good place to work, the opportunity to work somewhere else. Yeah.
Oh, thank you, Tim, and again, another 4 fantastic responses. Thank you, and you can see the amount of questions that are coming into the Q&A. I am obviously reminded that we've got till 2:00, so we've got another 45 minutes, but that will fly in. So let's go into the next question then. And this one comes to you, Lars and Tim, and Louise. I might come to you afterwards for a response, please. We're seeing cases, particularly in the US, of companies adopting a no job policy. What do you think of this? Oh golly, how are we going to calm Tim Eldridge down here? Go on then, Tim.
You know, from a scientific point of view.
Sorry, Dr. Lars, I was going to Tim, but you can come in, Dr. Lars. You can come in, Lars. Then you come.
Okay. So from a scientific point of view, I've already said that, you know, the vaccines have been fantastic in how efficient they are. So from a scientific point of view, it makes a lot of sense to have everybody vaccinated. But it's much more a legal question, I think, than a medical question. So I'll hand it over to Tim.
Oh, Tim.
Legal, yeah, but other implications. So first of all, I get it, right? I understand leaders, and it tends to come from the very senior leaders of organisations saying, I want our employees to be vaccinated before they come into the workplace. I understand what they're trying to do. They're not trying to be nasty or mean. They're trying to make the workplace safer. Fantastic. We've got CEOs talking about workplace safety. Isn't that great? However, what we found is that the well-intentioned leadership who are trying to find a way of making the workplace safer by suggesting mandated full vaccination to employees, they don't perhaps understand some of the consequences of such a policy. I think we all know about those. Number one, vaccine is only 90-odd% effective. So people will think, oh, well, you know, everyone in the office is safe. Let's get rid of all the controls. First of all, you know, that's clearly not the case. We have a question about how do you police this? Do you stand at the door of your workplace and ask every employee to show you their personal medical records? Some cases you may think that's the right thing to do. I don't think that's the right thing to do. And of course, as Lars said, in some jurisdictions and markets, that's actually an illegal thing to do. So why don't we just continue to encourage, let's encourage testing for the, you know, as well. And you know, there was a question on there, Jimmy, I can't remember who it was from, about incentives. And incentives have a place. I mean, I'd be a bit cautious about, you know, incentives like, you know, a week off or, you know, free beer.
I don't know, Tim, if they did a van outside Kentucky Fried Chicken for a 2-piece dinner with beans and chips, I'd be there every day.
Yeah, but I've
vaccinated to the full.
seen Jimmy, of course. But certainly, give your employees an opportunity to encourage them to get, you can have the time off required to go and get your vaccination, for example. So I could speak forever, Jimmy. I won't, but that's kind of my position.
Tim, I mean, some great questions here. I don't know what IOSH are up to. I think they're trying to catch us out here and trying to get through as little questions as possible. But we could talk about this all day, and I really do think about these incentives as well. But is being allowed time off from work to go and get a vaccination an incentive, though? Just throw that one back. Is it an incentive? Is it a right?
It's not necessarily a right, but it might be in some more countries. But certainly it is.
Of course,
the right thing to do, right?
My bad. Yeah. My bad. Yeah, sorry. Claire, you're nodding away again.
No, I just wanted to agree. Really, it's all right. I'm gonna.
Wonderful. Okay, well, we'll move on then. Louise, coming to you for a comment. Sorry.
Yeah, I'd actually be quite interested to hear Claire's view of the psychology behind some of this. But I've worked with healthcare professionals that have chosen not to take the vaccine, and these are people that are in very close proximity, providing personal care to others. And right at the start of the pandemic, they saw all of this work firsthand, but they're making their own personal choices not to have the vaccine. And that does put employers in really difficult situations where they've potentially done a risk assessment and said, well, this is, we've put in a range of measures, but actually in this situation, we feel that you do need the vaccine, and we're seeing this in the NHS in the UK at the moment, and private healthcare providers are being told that their people have to be vaccinated, and that decision has been delayed in the NHS. Yeah. So they're losing people to the NHS again at a time of a skills crisis. So.
No, thank you, Louise. And isn't it great? The consummate professional, Louise Hoskin, has teed you up for the next question, that we can use the comment that Louise wanted to talk about mental health, and we can change the question slightly, Claire. To what extent would you say senior management has set the tone when it comes to protecting workers' mental health, safety, and health during the pandemic? I've just thrown you under the bus a little bit there, Claire, but
That's
I'm sure
right.
you can incorporate that. I'm sure you'll be fine. How important is this, Claire?
It's really important. It's absolutely key. I mean, to start with the important bit, we just conducted an evidence review for the World Health Organization, looking at the evidence for and the conditions, the barriers and facilitators for where and why organizational mental health interventions succeed or fail. And basically, if you don't get proper kind of top-down support, they're much more likely to fail. So it's really important. Short answer. I'd say during COVID, and lots of the organizations we've worked with, senior leaders have taken a lead voice on mental health and wellbeing. It's been really particularly important for two reasons, I think. First off, because of the incredible confusion and changes in rules and changes in situation. I think there's been a real craving from employees just to have a single clear voice in their organization, filtering through information and saying what's what. And also because I suppose organizations have been under so much commercial pressure during the time, having that voice of compassion, and actually often having leaders who acknowledge vulnerability themselves and tell their own stories, are willing to kind of explain that they too have not always felt great. That's been super important in the period. That authentic messaging. And final thing, it's not just about senior leaders, it's also about line managers. They've got such an important role in translating information.
Absolutely. I totally agree. And I was on a mental health workshop the other day there with one of our branches, Claire, and they were talking about, I was looking from a veteran's perspective, but also from the perspective of speaking to people. When I go on site, I never ask anyone on site how they are. I always say, what did you get up to last night? What did you get up to today? What was your journey like this morning? What are you doing this weekend? And maybe sometimes I start with a funny, so golly, had a fantastic pizza last night, and I just engage in a conversation. I very rarely ask anyone, how are you today? It doesn't sit, but that conversation doesn't really happen for me. I try to engage more because of that answer you come back said, I'm fine. And then it then sort of puts under the conversation a little bit under pressure, whereas I approach from a different perspective. It'd be interesting to see how many of our viewers would be engaging that way as well. But again, when you're saying about line managers as well, it's important that line managers possibly engage as well, but engage with maybe other members of the team that are not maybe so well as being able to answer those questions or that management experience of a line manager. That's what I see in my own view as well. But you're absolutely right. Some great points there. And Tim, what do you, just coming from you, just to follow off the back of that question, what have been the key changes that IOSH has tried to get across in all of this? And what has the institution been doing to support OSH professionals in workplaces through the pandemics? Now, both of you are key to this question because to support Claire's answer, because both of you have been out there doing all this. Tim?
Yeah, I think one of the things that I've been really conscious of, and being fortunate to work for a large global organization with access to medical advice, is recognizing there's many health and safety professionals out there who are kind of on their own in a way. And so what IOSH's role has to be, and I'm really glad it has done this, is to bring us together. Let's join up our advice, let's get it out there, and let's support us all. I mean, I don't have all the answers and no one does, but together let's pool that information. And the one thing I always say to people is there's probably no question that hasn't already been asked. We've got 74 questions on the Q&A now, Jimmy, and every single one of those questions has already been asked before, and somebody out there has the answer to it. So IOSH is very much around, bringing that together, and as well as connecting with the experts like Dr. Lars and others to be able to get that real sound advice out to our members.
Absolutely. No, thanks, Tim. And we'll try and get through some of those questions before 2 o'clock as well. But thank you very much, Tim. Louise?
Yeah, I mean, wow. Jimmy, I mean, you've led this institution, as the ambassadorial president for the last, almost a year. And I've seen IOSH and its members just come out of themselves and support each other in a way that I've never seen before. Yeah. We've got some great materials, some guidance support on the website, so have a look at that. We've done a great, we've got information about mental health and how to, look at that within your organization. The networks have just been phenomenal, supporting members have been so powerful. And Jimmy, you've done a great job too.
Thanks, mate. That's very kind, Louise. I mean, this presidential team's done a wonderful job, haven't we? We've reached out to networks, groups. We've sat in conferences in Singapore. We've got up at 3 a.m. to speak live in conferences. With Tim all over the television, Mr. BBC. We're there and everywhere. We've used the whole skill set of this presidential team.
And we're still working, so
we're still doing it as well. So
we're right at the front end. You are on your construction sites. Tim's, Mr. HSBC, I've got, I had all of my, customers needed the same support at exactly the same time. Yeah. And we've still been out there talking about this, supporting each other.
And then we've got amazing professionals like Claire and Lars giving us their time as well, and the work that they're doing as well. So, well, let me move on then, Lars. I've got a great question for you. Do you see COVID-19 flaring up again and again and again in the future? And if so, what would be your key messages to those in the workplaces?
Now, like I said, as long as we don't control the global pandemic, we will continue to see outbreaks. Probably less so in Europe, but for a lot of us working for multinational companies want to travel again, visit sites in other countries, we will have to deal with the consequences of COVID and the fact that it's highly present in certain countries. So yeah, it's not over yet. It will continue to flare up. Europe is, reasonably well protected and will become better protected. And that goes to the workplaces as well. So what's happening in society, I think you can probably more or less extrapolate that into the workplaces.
Thank you. I'm just going to go straight on to I'm not going to come to the panel. I'm going to go straight on to a question here, if I may. It's been going here, yeah. Just let me find it again. There's so many questions coming in, everyone, so I just need to find it. It comes from Mark Hope, and I need just a quick 1 minute from each of you on this. Do we need to legislate to protect those? I think I'll come to you first, Tim, on this one. Do we need to legislate to protect those who are vulnerable to COVID-19 and do not feel safe in the workplace because of others' actions and inactions? Now, I know I'm coming to you for a question later, Claire, but if we could answer that one very quickly.
Yeah, to me, it depends what you mean by legislate. I mean, if you take that literally, does that mean should governments be enacting laws to deal with that? And I think, you know, that's a very different question to what an organisation should be doing. And, you know, what I would say is, from an organisational point of view, we have to recognise the vulnerable. We have to ensure that we provide the protection that our medical professionals are advising us to do, but that we don't discriminate against them in a way that's unfair. And it's not easy. And, you know, I guess the obvious answer, and Louise is going to say this if I don't, so, you know, let's just talk to them, right?
Absolutely. Yeah, good. Thank you, Tim. And just going on from that one again, I'll come to you just quickly, Claire, and I'll just get an answer from each of you. Should clinically extremely vulnerable people, so should clinically extremely vulnerable UK employees be working from home if possible?
I would say that we need to talk to clinically extremely vulnerable people, because in many cases, it's about communications and it's about personal circumstances. They should have the opportunity. That's all.
Thank you. Rob Dukes, are we seeing a rise in cold and flu cases both being more severe and being more transmissible due to a lack of immune resistance within the population, due to a reduction in cases of both during the COVID pandemic? Dr. Lars?
Yeah, so what we saw last year, strikingly, was very, very few flu cases all over the world, because last year at this time, we were keeping distance, we were using face masks, and you saw a tremendous reduction in the number of airborne infectious diseases, including the flu. The worry this year is that since we didn't have flu last year, we've lost some of our herd immunity against the flu virus. So that might make us more vulnerable this year than it was last year. And we are not as good as keeping distance and wearing face masks as we were last year. So there will be more airborne infectious diseases, whether it will be this explosion of flu cases or not, as we're fearing, we don't know. But we do expect to see more flu cases than, much more flu cases than last year. Yeah.
Wonderful. I hope that's answered your question, Rob. Louise, in the UK, will we ever get people back to the office?
I think we are getting people back to the office. You know, I'm out today in an office, which is, you know, probably it's not as full as it was, but I absolutely think that we will get people back to the office. I think the way that we use our offices will change, because, you know, we need to have that interaction. That is part of, you know, supporting our mental health as well. It's that you know, we need that collaboration in the workspace. And I think that we will see our offices used very differently as collaborative spaces where people have choices and they come in when they need to come in. And we've got that much more flexible approach. I think that needs to be combined with a sort of framework for how that's achieved, which is a challenge in itself.
Yeah.
But yeah, with a property background, I'm going to definitely say we need our offices, aren't I?
Thanks, Louise. Tim, what is your view on requesting unvaccinated staff to carry out lateral flow tests, as this is not the requirement for vaccinated staff? I love that. That's just a Tim Eldridge question all over.
I think I understand the rationale behind this question, and it's a reasonable one. I think the way to look at it is that there are some country governments, and certainly we've picked it up in my organisation in certain parts of the world, where they're actually saying that they want to enforce mandatory vaccination for employees in the workplace. US is a good example, and President Biden, I know, made a statement about that. And I think the question is, if that is actually a legal requirement and organisations need to do that, then clearly just saying only vaccinated people can come in the workplace has a problem around discrimination. But quite rightly, there's the alternative is to require testing as well. As an alternative for those who aren't vaccinated. So that absolutely fine with that if that really is the requirement. I'll just make one point, because I made this the other day to someone, is if you're going to be policing this, because obviously to some extent an organisation might have to do it, just wonder if you've got people who've got to show a piece of paper at the entry to your workplace, you actually create another problem where you've got a queue of 500 people trying to get in the workplace, all standing around and breathing each other's airspace. So again, think about the unintended consequences of some things that are coming into place.
Great answer. Thanks, Tim. Linda Jones, reach out to me at all, Linda Jones. Would anyone willing to share the communications to promote vaccination to employees, including Q&A sheets? I've got a plethora of stuff that we've got, so if you want to reach out to me and reach out to anybody in the panel, I'm sure when you connect on LinkedIn, we're able to help you in some way, Linda. Okay, just one more question just to go out, and then we'll go back to another question. Okay. I don't know if you'll be able to answer this one, Dr. Lars, but there is still a lot of scientific debate on airborne versus droplet versus aerosol transmission, which has implications on workplace controls. Maybe ask what your view is on transmission.
So in a droplet, which is that's
from Kim Sunley. Thank you, Kim.
Okay. So in a droplet, which is bigger than an aerosol, there's more viruses in the droplet. So if you get in touch with the droplet, you'll get infected more easily. But then you have to have a closer distance, because the droplets don't travel that far. That's the 1.5, 2 meters social distancing we're talking about. Aerosols do travel further, but have less viruses in it. And the aerosol transmission became recognized about a year ago that it does indeed play an important part of transmission of the virus. That has become even more important with the Delta virus, because the Delta virus is so highly contagious. So aerosol transmission is definitely important. And that's why ventilation is so incredibly important in the workplace. That's become more and more clear, especially now when we go into the winter months. We're going inside again, we're closing the windows, and ventilation in the workplace is absolutely essential, and maybe the most, after vaccines, the most important precaution we can take.
Thank you, Lars. Yeah, good, great. A great answer to that question. Would any of the panel like to come into that one? Just unmute and come in, please. No. Okay, let's move on then. We'll go to the questions in a minute in the chat box. Sorry, in the Q&A, Lars, because I'm sure there'll be. That's a great answer for. Oh golly, Miss Sunley. So that was fantastic. Okay, Claire. Before I come to you, Claire, I have got a question I want to ask you. There's one that came in the chat which I thought it had your name all over it. And it was about. Here we go. I'll find it, but I'll come to you for this question, Claire. What have been the chief challenges of such a dramatic increase in home working for employees, but also for employers? I could sit and you and I could just have a conversation for a couple of hours on that one. But yeah, as best you can, Claire.
Big question, Jimmy. Yeah, I mean, first off, as Tim said, it's important to acknowledge there's a group of people, individuals who love it, who feel their employees have entrusted them more than ever before, who never want to come back to work. The issue is balancing up what's good for the individual and good for the group. There's some particular groups who've suffered, particularly younger people. They've not had suitable workspaces. They've been living in houses with multiple occupants. They've missed having their managers around. They've missed having kind of coaching and support and socialization at work. There's particular occupational groups where it's been tough. We've seen lots of people in customer services jobs who've been taking very distressing calls from home. That's a massive problem. general problems that affect everyone, not having a suitable workstation, digital fatigue, not having breaks. Say for organisations, two big issues I'll raise. The first one is there's a growing tension between operational groups who've not been able to work from home at all during COVID and professional services groups, back office, who have. And there's growing resentments. And there's been a really interesting sort of thing that we've seen a lot actually, is managers during lockdown of those front-facing groups who've been working from home and trying to manage engineers or construction workers still on site. They felt it's been really hard. They felt real guilt about that. And hybrid working is going to increasingly be a real kind of workload task for managers, because it's like a double job, managing the needs of in-office, out-of-office. So that'll do for me.
I mean, I really felt for our document controllers when they didn't come back for months and months and months. They weren't furloughed, they were just working from home in a sort of one-bedroom flat in the middle of London. And I was back on site the week after lockdown, preparing to get us all back. And so for me, there was no change. Okay, I was on the train on my own. It was my train. And there's a great situation. People sitting next to me in a train now, these 4 seats are mine. What are you doing sitting here? I can't spread myself out anymore. But I really felt for the document controllers, because that is a really lonely, hard job at the best of times. But to be doing it at home and having that operational in that back room, yeah, I really get it, Claire. Any thoughts, Louise?
Yeah, no, I was going to say, we've got a lot of health and safety professionals on this call for obvious reasons today, I was forced to work from home, and you don't come into this job to be in one place. And I found that really tough. And I had a renewed appreciation for those people that do, even if they just go into an office every day. But I struggled to start off with, and we've had to find new ways of working, because we haven't been able to do, particularly when the people that you're trying to support are going through a rough time, and you should be there.
Yeah, no, get you, and I really understand that. And Tim, I'm thinking about you at the moment, because I don't believe that you've managed to get out at all, have you?
Oh, they don't let me out at all, Jimmy. I'm locked in.
I
went to the office. I went to my London office the first time in 18 months last week, and
wow. How did that feel, Tim? How did that feel? Did you get the train or did you drive?
Got the train down from Liverpool. Yeah.
Was it weird? Was it weird?
Yeah, it was a bit weird, but it was good to see people. I think the one thing I'm going to put, well, that's a good point in itself, just seeing people face to face, But and just again a bit of a flip on the question. For employers, this is a challenge, right? So an employer controls their workplace, and their workplace has defined boundaries. It's the end of the factory and the grounds. Where does the workplace start and stop at home? And I know at one point my organisation had over 200,000 employees working from home, and you can imagine the challenges that presented. So if someone falls down the stairs when they're coming from their bedroom to their office, is that a work-related injury? I mean, I just throw one of those things out. I mean, clearly ergonomics, and Claire, you'll understand the links between ergonomics and well-being, so on. But it's just a minefield. But it's something that we in IOSH need to be able to support our members on understanding. So I really encourage you to go and seek out the advice.
I'm going to spin that as well, though, Tim, because when it first started, I was lucky. I've got my 2 screens here, and I've got my laptops. I've got my 3 screens, so my workstation is set up as it is at work. I've got the exact same setup at work, so that was not a problem. So it's just plug in, plug out. I've got the same adapter, so pull my laptop and I go. And so that far from me, I've got my actual proper computer chair. My table that I work on is at the same height as my desk that would be in the study. So I'm very, very lucky and very, very privileged. But when you talk about that workplace, we can even spin it now to say that I started to work too hard because it was too easy to get out of bed in the morning, to just put my shorts on, have a quick shower, and I had to really start looking at how I had to get that role going from my workplace. So when I'm at home, it's like a workplace. I go out, I don't sit here and eat. I eat my lunch at the table, even though my monitor's right next to me. So all those things about being a workplace. You know, if you're at a workplace, you take your desk, don't you, at work most of the time. I had all those thoughts come through my head, so I don't think it's too far off the mark.
It's also, you know, there's multiple people in a house working from home.
Yeah, I'm lucky and privileged. It was just me.
And so if you've got, you know, grown-up children that are still at home and you're both working from home, you know, how do you, you know, we've had to juggle that, you know.
Absolutely. No, I've been very privileged to do it. So, and I've got a countryside outside me as well. So you are absolutely right, Tim, to throw that into the mix. From yourself, Claire?
Yeah. Do you mean in terms of my circumstances, or
No.
No, I'm actually really chippy about all this because I've got kids working from home, so I've been doing that through lockdown. Another kind of absolute nightmare. But no, no. What I would say is that every survey we run, everywhere we talk to, detachment from work is a massive problem. It's a massive problem for every single work group. It's really, really hard if you're home working to actually fully stop work at the end of the working day. I think there's been lots of tips and hacks. It's a whole lot easier if you've got a nice study than it is if you're working on top of the ironing board in an office chair.
And
which
it
I'm afraid
happened.
is happening.
we had people at work just the first couple of weeks were just sitting there with a laptop on their tops. But I wonder how many people, and I take this, no, I'm not going to say it. I will talk about it afterwards because I'll probably get into trouble. Lars, just a final point from you on this one.
I've been suffering from somitis for the past year and a half, certainly. I mean, we have been incredibly busy, busier than ever, but it's all what I call living in this one-dimensional digital world, which is, you know, and you do tend, as you say, you do tend to work a lot harder because you get out of your bed instead of traveling by car, by bike, or train or whatever, you know, and getting some time to kind of switch your mind on. You go straight into your work, and then when you're home, everything is set up. So you just have to do this and that, you know, just finish off this and that.
Yes.
So I certainly work a lot longer hours than I used to.
Yes.
I think for me personally, because my job is also a lot of traveling, interacting with people, projects we're running, etc., it's missing that human contact. It's all very one-dimensional. And even, you know, a session like this where we have 500 participants, if you're in a room with 500 people, you can interact much more easily.
Oh, the energy would be fantastic. I mean, we're trying.
Exactly.
I'm trying to get the energy going through the screen with all of you to try and energize everyone as well. But yeah, I know what you're saying, and you know, it was so funny. Last week I did some training, and I had 12 people in the room, and I said to them, just bring a notepad and a piece of paper, and what? And no laptop, no phones. I'll do the training. And because every meeting you go to, there's always 2 phones and there's a laptop and there's everything else. And they couldn't understand what I was trying to say. I'll do all the talking. I like talking. I'll do the presentation and you can listen, because it was a listening session. There wasn't a lot of interactive, and they had to listen to it and understand it. But they're too busy on the phone, listening, playing on the laptop, doing the emails while they're on the, get it all out and try and get rid of that. You know, there's a good argument, isn't there, on analog and digital, but that'd be another great conversation later on. Okay, right. I'm going to go to a couple of questions now, everyone. We'll try and bang through a couple of them. We've got 11 minutes left. I like to leave a couple of minutes left to go around the room, so we've got about 8 minutes. Short and sharp, please. Okay, I'm going to come to you, Claire. What do we feel about mental health of students and education?
Oh, in terms of how we protect mental health.
Yeah.
Do you know, I honestly think that the key messages are really pretty much the same across organisations. How do we protect mental health? Apart from the mental health counselling services that you have on offer, try to provide opportunities for students to interact informally as well as formally, as many digital forms as possible. Try to make sure that your organisational leaders, that there's kind of support points who people know who to reach out to. That can be much harder. Bear in mind as well that you really make quite proactive attempts to reach students who you perhaps haven't had a chance to connect with in the period. Like, one of the big concerns actually during COVID has been that people can just go off grid, and then we don't find out what's happened to them or what's happening with their mental health until quite a late stage. So be proactive about that, about calling in and checking in.
Wonderful. Thank you, Claire. I totally go to that. I've got a 22-year-old with me at the moment who just finished uni, just waiting to hopefully go to Sandhurst, kick him out in November, hopefully. But we'll see what happens. But he really struggled going through his dissertation, especially his dissertation, got sacked halfway through his year. But there's a lot, and I think we're going to see a lot of repercussions coming from the education side and student side in the next couple of years. That's my own personal thoughts. Thank you very much, Claire. Lars, Denmark, Norway and Sweden have removed all restrictions and no COVID passports required. What's your thoughts?
I'm very curious to see what will happen. And I truly hope, and I also believe that they have reached high enough level of herd immunity to do that. And I hope they're right, because that will kind of show the way for the rest of us.
Yeah, I get that one. I think everybody would agree. Anybody want to come in on that one quickly? No? Okay. Here, with regard to no vaccine, no job. No, we've done that one. Sorry, apologies. We've kind of answered it anyway. Let's go again. Okay, a panel question. We've got, 9 minutes? I think we can get through this pretty quickly. It comes from Nick Denny. Does the panel agree that as long as the risk from COVID risk exists, we need to continue to change our control measures and workplace practices accordingly, and not I think we've already answered that, haven't we? And not return to the old normality early until the risk is gone. I think we all answered that. Yeah, we all answered that one earlier. You answered that one, Tim, didn't you? I think you talked about keeping the COVID controls in place. And
just one thing I'll throw in, it's really interesting, is we never managed flu during as a workplace hazard. And clearly it was and had been, and we always, we had times when we couldn't deliver our services as organisations because we had to move people off. I think, Lars, correct me if I'm wrong, but I think the point is now that we live with communicable disease, and we actually need to live with managing it better in the workplace as well as in the population.
Yeah, we need to manage it better on the personal level, in the workplace, in our personal lives, social lives, and as communities. And one of the things I've seen changing is flu is a good example. We had flu every year. In 2017, 2018, we had a particular bad year here in the Netherlands, which is a much smaller country than the UK. We had 450,000 cases and 10,000 deaths. Nobody talked about it. We don't live in a risk-free society, and we never will. But now with COVID, all of us expect us to be able to control COVID so much that we will have a zero risk. That's never going to happen. There will always be a risk. And what it's really all about, COVID or flu or other hazards at the workplace, is a proper risk assessment, and then decide within the organization what is our risk appetite, what kind of risks do we tolerate, and realizing there will always be risk. I mean, when you get on the bus to your work, there's risk, right? You might slip because there's icy ground in the winter. That's a risk, so we have to kind of, I think, look into the kind of mind switch we've gone through, and maybe for part of that go back to where we were as well, because now we are expecting, taking so many precautions, being so careful that we have a zero risk of COVID. But what about all the other risks we're dealing with? So we're kind of off track here as well, and that's something we really need to talk about.
I mean, I was listening, Lars, and that's a great point. I was listening to two people having a very, very strong discussion. I think there was a little bit of wine involved. It was a Friday afternoon coming back in the train. Two real professional people. They look professional, the old suits, and it was a lady and a gentleman, obviously work colleagues, and they were arguing about the fact that we see the COVID stats every night on the television, but we never see any of the flu stats. Why are the flu stats and COVID stats not side by side, Lars? I didn't know how to answer that. I just thought I'd mention it.
One of the things that has surprised me is, the incredible attention to figures and numbers, which you've never seen before. I showed you some of the examples. There's 2 million people dying from tuberculosis every year. Wow. There's been 2.5 million dying from COVID so far in 18 months. There's 7 million people, more than 7 million people dying from tobacco smoking every year. We don't talk about that. We don't talk about those risks and those figures. So there's it's been an incredible and amazing focus on figures. while the only thing that really counts is how big is actually the consequences of COVID when it comes to disease and deaths. And that's what we should be talking about. And then, of course, the consequences of everything we've been doing over the past 18 months with the lockdowns and everything, with mental health problems, with hospitals being overburdened. You can't get treatment for anything else. Even doctors don't think beyond COVID. So we all live in this kind of COVID myopia world, and we need to get out of that.
No, thank you very much, Lars. And while the panel feedback's coming back up, the survey sheet, I'm just going to go quickly to Claire. Claire, just a quick one from Ajahn Nair. How can IOSH professionals show awareness on mental well-being to the workforce amid the COVID-19 pandemic as most firms move towards a hybrid working environment? How do we keep an eye on it? I think it was asking.
Yes, so in terms of tracking it, well, tracking through engagement studies and training, I'd say particularly through line managers, we find to be has been the most useful.
Yeah, it's been very useful for us at Multiplex as well. It really has. Our 120 odd mental health first aiders have been interacting very, very well. We've been very active. In fact, in the next couple of weeks, next week or so, mental health week, we'll be doing a lot that week as well. Right, everyone, I'm just going to go around quickly and just speak to you. We've got about 3 minutes left. I'd just like to have your final summary and thoughts. I'd like to come to you first, Lars. Thank you very much for joining us. Could you just summarise your thoughts for us, please?
I think key, as I said before, is communication, awareness, the right factual information, and we need to continue to push that.
Well, short and sharp. Thank you very much, Lars. Claire.
COVID's been an amazing opportunity to learn, to raise awareness of things we weren't aware of, to have different departments and IOSH professionals working in different configurations. Let's not lose that.
Wow. God, this is great. Louise.
Jimmy, you've been talking about members, and I'm going to be talking about people. So people create these issues that we find ourselves in. We're in a massively complex environment right now, and it's going to be people that solve these issues.
Again, fantastic. Tim Eldridge, back that one up.
I'm just going to reach out to everyone on the webinar. I mean, over 500, which is just amazing. And just remind everyone that, you know, we scratched the surface in the last hour and a half. There's so much more, but don't be on your own. If you've got a query, just come into IOSH. We've got the answers. We might not be the, you know, we'll find the right way of getting the answer to you. So don't feel alone, and you know, use IOSH as your source. We're here to help.
Oh, wonderful, and thank you very much, panel. I mean, we had we must have had over 100 questions because there's 93 in there, and we've answered a good 10 of them as well. I've never been part of a panel yet in the last 18 months where we had so much passion, so much energy, some fantastic answers, information to all our members. Thank you so much for that, to each and every one of you. I think we're going to be ending it there. Thank you very much, Claire. It was wonderful to meet you. Dr. Lars, wonderful to meet you. Thank you so much for your time. My two amazing colleagues, Louise and Hosking, and don't forget Ben, our amazing colleague that's been controlling everything from behind the scenes. Thank you again, everyone. I'll end with my Michael Parkinson-esque ending. Stay safe, stay well, and continue to be kind.